had the x-rays done, got my films here, ready to go, ready for Fernando to have a look at. Here he is, and CD as well. So good experience here. Looking forward to seeing what's inside my back. Okay, so we just come in to the wellness clinic now. Finally here, took a bit of time to find it. Just waiting for Fernando to pop out after the patient, and hopefully we'll get it on.
Well, tell me, how can I help you?
Okay, so I've been having lower back pain for the last maybe 7-8 years, started. So it's mainly on the left side. Started off very slowly, sort of for no particular reason, just came on. And over the years it's gone up and down. Sometimes it gets quite irritated.
Okay.
And then it gets better by itself.
So was the left side?
Always left side, yeah.
Okay. Does it go down the leg?
For the last, say, 3-4 years down, the pain started to become going down the leg.
Okay.
Yeah.
Back of the leg, the side, front?
Back of the leg, back, sort of the bum region,
yeah.
Then down the back of the leg here, sort of nothing. Sometimes it goes a little bit past the knee as well, but doesn't go much further than that. But when it's really bad, most of the time it's around the actual, just the back itself. Yeah.
When you get really bad, it can go up to the foot?
It can go down, probably I'd say
calf area?
Calf area.
Okay.
Yeah.
Any pins and needles? Numbness?
This recent episode, there was some pins and needles in the toes, but it came on more when I was sitting for a long period of time.
Okay, okay. Have you tried treatments for that?
Not really. I had an MRI a few years ago, everything looked fine. That was about 5 years ago when I first had the back pain.
Okay.
Didn't really have anything done for it, to be honest with you. Yeah.
And what tends to aggravate this pain? It's worse sitting, walking, standing, laying down in bed? Have you noticed?
The sitting. Sitting is the worst thing, yeah.
Okay.
So I do an office job, so I'm in the chair most, like 8-9 hours a day.
Okay.
Probably after about a couple hours of sitting, I'll start feeling the pain come on, and then you can really feel it in the back, and then sometimes down just to that area. Then. And then like when it's really bad, like I said, it will go a bit further. And then the leg, the foot doesn't feel right. Like a little bit of that pins and needles.
Okay. And then when you stand up and walk a little bit, you feel slightly better, right?
Yeah, definitely.
Okay.
Yeah, standing and walking. I can't stand for maybe more than like 20 minutes still. Then it does irritate. It does irritate, but it's almost like a different pain than when I'm sitting. It's much more of a worse pain when I'm sitting.
Okay. Any other complaints that I should know? Aches and pains?
Otherwise, no. Everything else is okay, but yeah, just mainly the back.
Mid-back, shoulders, neck, all the knees, all the ankles?
Ankles are fine. I did tear the ligaments on the left side a few years ago.
Okay.
Football injury about, I'd say 4 years ago.
4 years ago?
Yeah.
Okay.
I've had on and off aches and pains around the shoulder, neck area.
Okay.
Gets worse when I'm sitting, so I just try and correct myself, or movement really fixes it. Yeah.
Alright. Any history of accidents? Falls? Broken bones?
So
Car accidents?
No serious car accidents that come to mind. Probably the worst thing, most recent thing, is a fracture of the collarbone, skiing accident, about 3 years ago. So I had a metal plate put in to repair that. No other major accidents.
No surgeries?
No.
Just for the clavicle, right?
Just the clavicle, no other surgeries.
Right. Now, systemically, let's start with your digestive system. Any problems? Stomach aches, reflux, constipation, diarrhea, anything like that?
No serious episodes of that.
Okay.
No.
You know, blood pressure?
I think I'm slightly on the high side. I haven't had it taken recently, but every time I've had a reading, it's in the sort of 130, 140 sometimes.
And the second reading?
80.
Okay. Any issues with, asthma, lung infections in the past that I should know, and breathing problems?
No, all fine there.
Allergies?
None.
None? Okay.
Just occasional hay fever in the summer season.
Okay. So systemically you're fine, apart from you think you have a high blood pressure, right?
Yeah.
Okay.
No, I haven't had the doctor diagnose it or anything. It's just something I've noticed every time I've had a blood pressure reading.
Okay. Now, any family medical history that I should know? Again, can be heart issues, cancer, diabetes, joint-related problems, anything like that?
Grandmother had arthritis, not the rheumatoid type,
Okay.
the other one. And my grandfather had type 1 diabetes.
Okay. Are you taking any pills at the moment, medication, supplements?
No, nothing.
No?
This recent episode got quite bad, so I had a few paracetamol and over-the-counter painkillers.
Any problems during the night when you're sleeping? Changing positions in bed?
Not so much during the night, but when I wake up, it is definitely stiff.
Bed still, right?
Yeah.
Okay.
Sometimes I feel like I have to get up in the middle of the night. If it's too achy, you need to go
Back to
walk
walk
around for a second or two, and just try and loosen up.
Okay. Is there anything else you want to add?
No, I think the main thing is just that, it definitely gets better with the movement. The movement helps.
Okay.
And it does go through periods where I'm managing it, and then it can really flare up and get worse, and that's when I sort of get those symptoms going on.
Alright, so the first thing we're going to do with you today is I'm going to check for your body alignment, okay? Because I believe that if you have a good alignment in your joints, your body can work much more efficiently. Alright, so let's start with that first.
Okay.
And then after that, I'm going to be checking your whole spine for any levels of inflammation, okay? Potential nerve pressure, okay? But let's start checking the alignment first, okay? So you can take the shoes, you can keep your jeans for now, just take the top, alright?
Okay.
Come this way. So first we're going to check the overall rates of movement. Okay, arch backwards for me. Any pain, stiffness, let me know. How was that, okay?
Yeah.
Alright. Now we're going to lean to the left. Okay,
Through the stretch pain then.
right here.
Yeah.
Okay. Right side.
Yeah. Back. Yeah.
Painful?
Yeah. Or across here on the flank.
Okay, now turn your upper body, drop the shoulder. Is that okay?
Yeah, it's okay. Not too bad. A little bit in the back, but not too much.
And you feel it's different pain, or is the general pain that you always feel?
Different.
Different, okay. Turn to the right, drop that shoulder down.
Pain here.
In there.
Yeah.
Now you're gonna bend forward, start with your neck. Try to touch the floor, keep your knees straight. Anything going on?
No.
Okay. Come back. Alright.
Slightly relieving.
Okay. Stretching, right?
Yeah.
Alright, so we're gonna check now your pelvis. Now the pelvis is this area here. Okay. It's made up by this bone, this other bone, and this bone in the middle. This is the foundation of the body. Okay. We gotta make sure this is stable.
Okay.
If this is not stable, it can cause problems high up and lower down. All right. So we're gonna spend some time examining this first. Okay. So first test we're gonna do is you're gonna pretend you're walking and you're gonna march in place. Okay. Just just
Like that?
a bit more. Lift your knees a little bit more. There we go. And then after a couple of seconds, I want you to just stop the way you feel comfortable, okay? Just the way you feel comfortable. Okay. The first thing we check here is the level of the pelvis, the level of the gluteal folds, and the position of the foot. Now, your foot on the left is slightly more in, right is more out. Have you noticed that? Have a look.
Right, yeah.
Yeah?
Yeah.
So this could be coming from the pelvis, could be coming from the knees, or even the ankles, okay? So we're gonna try to figure out if this flare of the foot is coming from here or not.
Okay. Okay.
So what I want to check first is the cheek, okay? This area here, bun cheek. So for me to check that, I just need you to just put the jeans down, just for a second. Just the jeans down. Everything down.
Okay.
So what I want to check here is there's one cheek bulging out or not.
Mm-hmm.
Right, so the right side is bulging out a little bit more than the left,
Mm-hmm.
but it doesn't correlate with the foot. Okay, this one is out because that pelvis rotated outwards.
Mm.
So if that was the case, your foot should be in. Okay, so you might have something else going on in the hip, knees, or ankles. Okay, all right, bring it up for me. Now let's check the knee width on the sides. Come close to it a little bit more, slightly to the right. Okay, good. Now hands on top here. I'm going to ask for you to lift one knee and then lift the other knee. Okay,
Mhm.
let's start with lifting the right knee for me. Slowly, everything slowly.
Okay.
Go again, slowly, slowly. Go up, 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 up. There we go, and down. Down. Now the left side, same thing. Go up. A bit faster if you can. There we go. That's better. Down. Right side. Go, 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 go. That's dropping pretty good. And down. Left side. Dropping pretty good also. Down. Right. Go, go, go. Pretty good. And down. Left side. Go, 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 go. Dropping down also. Right side. Perfect. Good. Down. Left side. That's good. And down. Let's check the right side again here. Right knee again. Up, 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 up. And down. And the left. So apparently, no significant restriction with the pelvis, okay? We're going to do a second test for the pelvis. Just sit down here for me.
Okay. Facing this way.
Facing that way. Be close to the edge for me. Be close to the edge. There we go. Not too much. That's it. Keep your feet together.
Alright.
Sit up straight. Good. Now, you're going to keep your feet together.
Mm-hmm.
And you're going to open and close your knees. Keep your feet together, okay? Open and close.
Now this?
A bit faster, yeah? There we go. Keep doing that for me. Put a rhythm into it. Yes. A bit more faster than that. Perfect. Alright, and close. Now open and close the right side only. Keep doing that for me. Keeping your feet together. Yes. Okay, don't open too wide then. Yes, there. That's good. Just keep doing that for me. Close. Left side only. Close. Right side only. Alright, so when you move the right side now,
Mm-hmm.
that left want to go with it.
Okay.
Okay? So this is telling me that you have a slight fixation on this left pelvis. Nothing significant. We want to compare both sides. That side is more tight than this. Okay?
Okay.
That's the first finding we have. Right, this is slightly up, this is slightly inferior.
Mm-hmm.
So we're thinking that maybe that pelvis has rotated backwards, okay?
Mm-hmm.
When this happens, the inflammation tends to be on the top of the joint. Now if I press there, how is that?
That's tender.
That tender.
That's very tender.
If I compare with this side,
Fine.
not too bad. So
Yeah,
that's
you
different.
really hit the spot there.
Yeah. What about here?
Not so
Not
much.
too bad. Yeah,
No.
that's the one there.
Cool.
So that's the
Yeah,
first
yeah,
finding we have here on the pelvis. Okay.
Yeah, yeah.
All right. You can sit more backwards now.
Feel like you really go on top of it there. Yeah.
Okay. Now we gotta check your spine. So this machine here detects heat, basically. Okay. I want to scan your spine from the top to the bottom.
Mm-hmm.
I want to see if I can pick up any areas of inflammation. When those little joints here, the vertebrae, they get stuck, you can put pressure on the joints. You can also put pressure on the nerves. And this will change the heat reading at that level. Okay?
Correct.
So I want to scan your whole back and see if I find any areas of inflammation. Okay, I'm just gonna take my time on this,
Yeah.
right?
Yeah, got it.
Okay. Now I understand that your pain is right there on the lower back, but the spine is one unit. Okay, it's like when you go to a cardiologist, he's gonna check your whole heart, your whole lungs. Same thing with the spine. We check the whole spine, regardless of what the pain is. Okay.
Got it.
So we're gonna start from here.
I should mention that I've had a recent episode of neck pain here.
Okay.
It's still a little bit bad actually.
Okay.
I did that playing sports on the weekend
Okay.
a few days ago.
And how's the shoulders?
Um,
Shoulder joint itself.
the shoulder joint's fine.
It's fine. Okay.
Yeah, it definitely seems more like that.
All right. So let's have a look here. Go slowly, slowly. So I'm looking for a sharp deflection of the needle. So I'm gonna scan your whole spine first, so the machine can get used to with your temperature, and then I will come back to the top. Have you tried putting some ice on your lower back when it flares up?
No, I haven't actually.
Okay.
To be honest. Is that a good thing to try?
Yeah, ice is the first choice to help to reduce inflammation and pain control. Okay,
So no heat then?
no heat. Heat tends to make things worse in terms of inflammation. You may feel better at the time, but the next day you're gonna be worse. Okay, so try cold first. So maybe a potential area here.
Should I stay relaxed with my spine?
Yep, just relax. Spend a bit more time on your lower back. Alright, a little bit of a break right in here. Saw that? It's clear. Boom. Okay. Definitely something going on in there. Let's check a little bit more on the top here. Now we're gonna focus today more on your lower back, but I want to have an idea what's going on with the rest of your spine. Okay?
Okay.
Yeah. So here I get a potential reading as well. Yeah. We'll check that. Let's check the neck here. How is the jaw? Okay?
Fine. Sometimes I can get pain on this side actually. Just
Okay.
I just near the ear.
You're gonna have a
Sometimes if I start to eat and I bite too hard or quickly, yeah, it can get quite a sharp pain there.
okay. Okay, you also have a potential reading right in here. All right, so you got a reading the base of the neck. You got a reading in the middle of your spine here, and a reading lower down with the pelvis involved. Okay. Now I want to just run my fingers down your spine now to see if there's any inflammation involved. Okay. So let's start with this area here. So I'm just gonna run my finger down like that. It's nothing. Starts there.
Yeah, that's actually painful.
And then builds up here. Okay, it's clearly that one. Now, if I go and press around there, just let me know. Number 1 here, number 2, number 3. They all good? Okay. Bend a little bit forward. Now, I know this is not sore, but what I'm looking is for a point that maybe is more sensitive than the other ones, okay? So I'm gonna give you the first one. This is probably nothing there. And we have this one here. And we have that one.
That's
a little bit more.
Yeah.
And that one.
A little bit less.
Okay, this is more,
That's
right?
the one.
Okay,
Yeah.
so yeah, we got the break there, so that's become relevant now because we got a reading right in that joint, and it's also a little bit tender, and you can see clearly the inflammation building up. So that's a good finding. All right. Now we're gonna check the lower back here a bit more with the machine just to make sure. No, definitely get a reading here.
So could what you're picking up in the mid-back be linked to the lower back problem?
It could be, okay. So helping this, adjusting the lower back, it can change this reading. But from what I'm seeing, you might need also an adjustment here. Okay, maybe not today, but down the road. This type of issues develop because of a trauma, posture, not sleeping right, or emotional trauma, too much stress. Okay.
Right.
So I'm gonna press 2 points now. That's L5. Arch a little bit more. Yes. How is that one there?
That's a little bit tender.
Okay. How's that one there?
That's okay.
That's okay. Bend forward for me. So we can go underneath now. How is this?
Tender.
How is this?
Yeah, it's tender. Not as much as the one before that.
How is that?
That's fine. That's tender. Yeah.
Which one is more? Number 1? Number 2?
I'd say the same, but maybe number 1 slightly more.
Okay. Okay, you have potential L5, L4 here. Okay. And also a pelvis on that left side. Okay, so the next step now of examination will be the X-rays analysis. So in this work, we do first the history, we do the instrumentation, palpation, meaning where it's painful, where the inflammation is, then we check the X-rays. Now the X-rays, we don't look at the X-rays to find where the problem is. We look at the X-ray to find how is the best way to correct that segment in question. So we already found the segment. We're going to use the X-rays to have a 3D analysis of your back so we can check exactly what's the best way to correct it at. Okay?
That's it.
So let's have a look here. Alright, so for this analysis, I'm going to check what's going on with your pelvis first, okay? Just to reinforce that I'm not trying to find where to adjust or where to treat.
So what points are you marking?
So this is the landmarks that I'll need to draw some lines, okay? I'm going to draw some lines and I'm going to do some measurements so I can check the level of imbalance that you may have. Okay, now everybody has some types of imbalances. No one is textbook spine. So the first line we draw is the hip line. That should be ideally parallel with the floor. You have a slightly tilt there, but that's fine. Up to 7 millimeters, our body can adapt pretty well. Then we're going to draw the lines on the top of the iliums. There. That's one here. The second one there. And we're going to turn it. We're going to draw now on the ischium tuberosity. There. And there. That's the sacrum line here. And that's the lumbar spine there. Okay. Now this is for the sacrum analysis. All right, let's check this. Now we're gonna measure. So we're gonna measure now from the top of the ilium to the bottom. Okay? We have to be very precise in this because every millimeter counts. Okay. So when these bones they rotate, okay, in the X-ray analysis, more the bone rotate forward, less you can see the bone. More you rotate, more you can see from top to bottom.
Right.
So this one you have 2, 4, 5. This one you have 2, 4, 6. This means that this bone is slightly rotation forward. Okay, it's a very minimal malalignment. Okay. The ilium can go anterior, posterior, and can go in and out. Okay, you have 3 millimeters of this bone here going in. Okay, I can put it here. Right. Now, when one side goes in, the other side goes out. Okay, but again, this is pretty minimal malalignment. Okay.
Okay.
Sacrum is pretty equal here. 68, 69 is pretty good. So what I'm getting here is that that side has rotated anterior and in. The other side goes posterior and out. Okay. I found a new issue on this left ilium. Okay. This left ilium is rotated backwards and rotated outwards. Okay. So it's rotated 1 millimeters backwards and rotated outwards 3 millimeters. Okay.
Right.
Again, it's a very minimal malalignment, and I think that I have a very good recovery because if this was 5 and 5, it's a huge misalignment, right? It'll take a little bit longer. But 1 and 3, that's pretty good. Okay, so prognosis-wise, this ilium is going to be aligned pretty quickly. Okay.
Great.
Now, we want to check now the view from the sides. Okay, that's a very important view. We're going to check disc space, and we're going to check if you have any malalignments on the vertebrae. Okay.
Great.
I can check right now here. So, first of all, we're going to start with this bone. This is the sacrum. Okay. Now this bone here, when you're born, it's 5 segments. They are separately. As we grow, after 25, 26, they tend to fuse. Okay. Now you have very good segments. Everything is fused here. Everything is great. You have a remnants of a disc space here. Okay.
Oh wow.
Although it's not open on the back, which means it's a good sign.
Okay.
Right? If it was open on the back, it would be a bit more relevant. Meaning this could be causing this type of problem that you have.
Right.
Okay?
Right.
But this is closed, which is pretty good. The next segment that we're going to check is the alignment between the sacrum, which is S1, and L5. I'm gonna put a dot on the back of S1, dot on the back of L5. Okay? Now ideally, you want to see those two dots close together, aligned together.
Right.
In your case, the L5 is slightly posterior. Can you see that?
So it's going back.
So slightly.
Mm.
Okay? Now, if I go on the second and above, now this is just a osteophyte there. We don't count this. We come here and we come here. Right? We don't count that little extra bone here, right? This one, align, slightly back on that one, and slightly back on that
Is
one.
it normal to the osteophyte?
Generally, osteophytes is to do with too much movement in the joint. Your body tries to stabilize by producing more bone to keep the bone stable. Okay?
Mm.
So I think on you, the problem is coming from L5. You have pelvis on the left, L5 as well.
Mm.
Okay? This L4, it's a compensation from L5. That's why you can see the extra bone growth there.
Mm.
Your body is trying to protect itself by putting more bones to stabilize. Okay?
Mm.
Overall, nice curve you have there.
Mm.
Nice lordotic curve.
Mm.
Okay? So today we have two areas to work,
Mhm.
left pelvis or L5.
Okay.
Okay?
Mm-hmm.
Now, because you told me that it's much worse than sitting down,
Yeah.
walking is better,
That's right.
is it? Standing, not too good,
It can be painful standing.
but walking is definitely better. Now, we have a general rule, which is if there is a pelvic issue, if the pelvic is a major, it will work when you stand up and walk. Okay? Because you need that joint free of any inflammation for you to be able to walk. If it's a lumbar spine issue, it will be much worse sitting down because you increase the pressure on the disc.
Right.
Okay?
Right.
So based what we gathered today and based on the x-ray films, we're going to start today on L5. Okay?
Okay.
Now, we might have to come back to the ilium. Okay? This would depend on your next visit. Okay? If you tell me like I'm much better, but now, you know, when I stand up and start walking a little bit, I still feel a little bit. Sitting is better. I may move to the ilium. Okay? They're very close together, so one will affect the other. Okay?
So we're going to work here.
L5.
there.
Let's start with L5.
Nice.
Okay? Now, we know the L5, it's slightly posterior. Let's give me confidence to go there first. Okay? Now my next decision is how to adjust your L5. Okay? I want to be very specific. Okay? We know it's posterior, but the vertebra can go posterior. You can rotate to one side, to the other side, you can side bend.
Mm.
Okay?
Mhm.
From the films, we know that you don't have too much tilt. Those two lines, they're parallel, can you see?
Okay, yeah.
So tilting wise, it's very minimal. But when we look at rotation, this is much wider, this is much narrower. Can you see
Right,
that?
Okay. Mm.
This is telling me that this bone turned to the right.
Mm. Mhm.
Okay?
Got it. Okay.
So I'm gonna list this bone as a P, posterior, R,
Yeah.
because that bone in the middle rotated to the right. So based on that, I'm gonna adjust your lower back now.
Got it.
Okay?
Mm-hmm.
Right. Okay, this comes this way.
Question from my own curiosity.
Yeah,
right?
okay.
You know that view?
Yeah.
Would that be like looking from behind?
Behind. Right side, looking from behind.
Oh yeah. Yeah. Cool.
Then these, they look
Yeah, I noticed you were looking.
look
at
from
it.
behind.
Yeah.
right? Now we know we have something here as well, okay?
What have you picked up there?
I mean,
Oh,
pelvis.
from the pelvis. Yeah.
Okay.
Mm.
It's a bit restricted, it's tender, okay? Now, pelvic problems, especially posterior pelvis, can also cause pain sitting. Okay? But the reason why I'm going to go with the L5 today is because you're telling me sitting is much worse.
Much worse, yeah.
Okay? If you said walking was slightly worse, I'll go with the pelvis. Okay? That's why it's important to hear the patient and hear the history. It gives us where to start, right?
Yeah.
So I'm going to go with the L5 today. So another thing that is important here is we're going to use that one.
Okay.
When I got the reading on your back, I got a reading kind of L4, L5. Both of them were tender. Now I'm using the x-rays to decide which one is relevant. I told you before, I don't use the x-rays to tell me where to go to. I use the system. Sometimes I may be in doubt, is number 1 or number 2? In these situations, I use the x-rays for the decider.
Right, yeah.
And in your case, because it's more posterior than this, I'll go with L5. And it's much safer to go with a lower segment than a higher segment. Because the lower segment, it creates a foundation from the top. Right?
Makes sense. Makes sense.
So we're gonna adjust your lower back from this way here. So we know this is a PR. So you're gonna lay on your side, facing me. Okay?
That's you?
Yeah. Come close to me. There we go. That's good. Just open the jeans on the bottom there for me. That's good. Now, the idea here is for you to relax and do not help me, okay?
Yeah.
Now you're gonna feel a bit of muscle stretching, okay? And I will push with my fingers this one, okay?
Okay.
Alright, stretch the legs. Bring the top one here. You're not gonna fall, don't worry. There we go. Just a bit of a traction to take this leg out already. Stretch the legs and the top. Okay. Well, I can see you're pretty flexible.
Yeah.
Give me this arm. Well, don't help me here. Just let it loose and relax. You okay with the clavicle there?
Yeah.
Okay.
That's fine.
Okay, just like this. Head back. Shoulders relax. Okay. That's your pelvis. How's that? Is that a bit tender?
Yeah.
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 That's too loose, just right, too tight. So we're gonna find the right tension point. Somewhere around here. Alright, so I'm just gonna stretch you up a little bit first. Stretch this way. Now, let's see how far you can let me bring that shoulder up. Is that okay?
That's fine.
Alright. Tiny bit more there if you can. Still good?
Yeah.
Okay, just everything relax for me. Shoulders loose. There, we got a set.
Wow.
There we
Nice.
go. Okay. Now, don't lay on your back. Stay on your side and stand up for me. Don't lay on your back, yeah? Keep on your
Stand
side,
up
yeah?
for
And
me.
walk a little bit for me. Just walk a little bit.
Feels like a cold sensation here.
Yeah. So this is
Yeah.
basically taking when you take the pressure off the nerve,
Yeah.
this is what you feel. Right?
It's almost like I haven't felt that before, but it's like a feeling's coming back a bit.
Yeah.
That feels good.
Now, walking is very important. It helps to reinforce the position of the bone.
Mhm.
Okay. It helps to decrease inflammation. There we go. How are you feeling there?
Yeah, feels great.
Okay.
Yeah, yeah, yeah.
Okay.
Feeling like that same sort of sensation coming down the front, just like a nice, sort of almost like a cooling feeling.
Pretty good, right?
Yeah, yeah, definitely.
Let's do the mid back here.
Okay.
Analysis. What's the position of this joint? We don't have the X-ray, so I'm gonna use some visualization to find the listings, to find the position of this ball. Okay, we know you have something around there, right?
Yeah.
Okay, this is okay,
That's
this
fine.
is not good.
Mhm.
So, to check for the wedge, for the side bending, what we do is this. Sit up straight, lean to the right side. Lean to the left. Right. No, there's more curve when you go to the right side. So this is telling me the wedge is on the left, side bended. Okay? The wedge is on the left. So this is the first finding. Second finding will be the rotation, and I'll do this and this table here. Okay? So this table is great because if I try to push that vertebra on the normal table, I'm going to squeeze it too much. This one, there's nothing on the front, so your spine can just drop down, all right? And it'll be much more comfortable for you, okay?
Right.
So, go that way. Knees.
Nice piece of kit, dude.
There it is. There. Face there. So we're gonna check first if this is the right height for you.
Do I just leave my arms loose?
For now, it's okay. Just bring yourself up, chin up as high as you can. Make sure it doesn't hurt your nose there. Now, hands like that. That's good. So you don't push yourself up. Bring your knees back for me a little bit and open to the side so you're more stable. Now, I want you to, that's good. Not that much. Hold a little bit more. Now, I want you to relax that tummy. Bring it up first and all the way down. So your tummy has to relax. And again up. All the way down. That's pretty good. And then shoulders relaxed. That's the one.
That's the line.
That's the one. Shoulders relaxed a bit more here. So we know the wedge is on the left side, alright? So we're gonna check the rotation. Okay, so we have a PRS. Okay, this side is higher. So the spinous process rotated to the left. You understand? Because this side is higher. So based on that, we're gonna adjust as a PRS. Still that one, right?
Yeah,
Okay.
definitely.
So just tissue pull, just like this. So we're gonna come up in that angle like that. Okay. Now if I put some pressure there, is that okay with your throat and chest?
Yeah.
Okay. Just drop the belly for me. Bring the belly up. This has to go all the way down, all the way down. Drip the belly a bit more. Make your belly touch the floor if you can. That's much better. Shoulders loose. There we go.
Whoa.
There. Come back up.
That was quick. That was good.
And walk a little bit.
That was a good one.
Catch. I just enjoy it, then.
Yeah,
Come on.
man.
Catch it out.
We'll have to. I'm gonna keep this bit in the end.
Yeah, do that. That was an incredible
That was
adjustment.
good. Specific.
Very specific.
And
It's really different from the feeling you get when it's dog like that. It's really
deeper.
different.
The sound is different.
Yeah, yeah,
It's
completely different.
more like a clunk.
Yeah.
Yeah. Now we adjust the bones.
That was incredible.
Bring your hand there for me. You know, when patients has chronic pains, I like to adjust and maybe two or three drops, just to control inflammation. Because the fluids, they're going to start to move now, you know. And during that process, sometimes it can be slightly sore, but that's kind of normal. Here we go, just like that. This is going to give you a feeling of refreshment now, you see.
Oh, good.
Walk a little more. So after here, I suggest doing a bit of walking, maybe 20-25 minutes.
Okay.